Dr. Denise Ejo, the CEO of Commemorate Cancer Foundation. I would like to welcome you to our Commemorate Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
In the rest of the world to mark the World Cancer Day on Saturday, and the day set aside to raise awareness on cancer. And that's why we're being joined by Dr. Denise Ejo this morning, who will be hosting the CEO, Union for International Cancer Control, Carrie Adams, and the Executive Director, Project Pink Blue, Ranchi Chidebe, to discuss more on this. It's over to you, Dr. Denise.
Good morning, viewers, and welcome to another edition of our Kakaki Cancer Awareness Program with Dr. Ejo, CEO, Commemorate Cancer Foundation, and Band AIT. Thank you all for joining us this morning, and today is a very special day, or rather tomorrow, the 4th, is a very special day for everyone as we start to look and reflect on what's been happening in the cancer space for the last 1 year and where are we going next for the next 12 months. Okay, so where do I want to start? I first want to thank the two people that I'm sharing the platform with today, or rather the screen. As you can see, I have got in the house Dr. Carrie Adams, the CEO of the Union for International Cancer Control. You can remember I shared with you all that last year was the first time I went, and it's an honor to have you in our room today, Dr. Carrie. And who have I got on? I have got my our brother, you all know him, Ronsi, always making a lot of noise. Ronsi Chidebe, the Executive Director for Project Pink Blue. I want to thank you both for joining me this morning, and I hope we're going to have a fantastic chat on everything that we expect and what we want to achieve in the next 12 months. But as a quick reminder to everyone, this is World Cancer Month, and there are some facts that we all need to be very aware of. So I want to put that in place. Let's put the conversation in context. According to the UICC president, and our UICC CEO is sitting with us today, in January 2023, there were an additional 1.8 million people diagnosed with cancer globally. And sadly, in the same month, around 900 people have died. That's January 2023. And this is February the 3rd, have died of cancer in January alone. So I'm choosing to start this conversation from let's look at what we are and what we're going for. And as you know, I live with this disease, so we're not going to sit down and make out it doesn't exist. Firstly, I'd like to introduce our special guest in the house today. Dr. Carrie was born in London and has a degree in economics, computing and statistics from the University of Bath, United Kingdom, and a master's distinction in business administration. He is a Harvard Business School alumni, having attended the school's executive general management program in 2003. In 2009, Carrie made a career change, moving from the management of international businesses in the banking sector to become the CEO of the UICC based in Geneva. Carrie and his team focus on global advocacy, convening the cancer community through World Cancer Day, the World Cancer Congress, and the World Cancer Leaders Summit, and running significant global capacity building projects that address global cancer issues. In 2014, he was awarded an honorary doctorate in international relations from the University for Business and International Studies in Geneva, and in 2015, an honorary doctorate in health from Bath University in the United Kingdom. And in May 2015, Carrie was awarded CEO of the Year at the International and European Association Conference, organized by the Associates Network. Good morning, Dr. Carrie Adams, and thank you very, very much for joining us. We are honored to have you, and we are looking forward to a fantastic conversation with you.
Well, it's a pleasure to be here, Denise, and thank you very much for that introduction. It made me feel very tired.
I have to do it. I have to do it. I don't have a choice. People want
Oh
to know
no,
want to know who you
when I
are.
say all that, I think, oh my God, did I really do all that? But yeah,
Exactly. Yes, you
and as
did.
usual, everything you do it through other people and the help and support that you get from others. So, it is a team effort in everything that we've done.
Thank you. And I will also make a point. I have to introduce our very own Ronsi Chidebere. Ronsi is a cancer control advocate, global health consultant, research psychologist, and the executive director of Project Pink Blue. He is one of the leading voices advocating for Nigerian government to make cancer control a national health priority. He has been engaged in supporting women battling with cancer, hosting oncology trainings for doctors, nurses, fundraising for indigenous patients, cancer awareness, founded Nigeria's first patient navigation and the first cancer support group in Abuja, Nigeria. My very own Ronsi, and I'm very grateful. Thank you for joining me today. Thank you. So where do we go now? I'm starting off the conversation with Carrie. So Carrie, are you ready for me now?
I'm fine. Go ahead.
Okay. Please, can you tell us what UICC is, the aims of your organization, and what do you think are the most pressing challenges regarding cancer care globally?
Well, thank you for that question. So, Union for International Cancer Control is quite an old organization. We're 90 years old this year. And we have a clear purpose statement, which is about uniting and supporting cancer organizations around the world so they can share best practice, get to know each other, support each other, guide each other, etc., to address the global burden of cancer, which I'll talk about in a moment, and to address the issue of inequity around the world and make sure that cancer is on the global health and development agenda. So we're based in Geneva because a lot of our work is working in the global health space. So we work with the World Health Organization and many other UN agencies and other international organizations who are trying to make sure that health stays as a global priority and also a national priority everywhere around the world. We also convene the world. You mentioned the World Cancer Congress, which you came to in October, which is a fantastic way of bringing the community together. We have World Cancer Day tomorrow. Again, we try to bring that community together so that they can be a one voice talking about a key issue, which is to address the issue of inequities around the world affecting cancer survival rates. And also we run like the World Cancer Leaders Summit when we bring the leaders of all cancer organizations together to make hopefully a decision on how we can take forward cancer control in the future. I will stress we are cancer control. So we are interested in the prevention, the early detection, the treatment, and the care, because we can't look at one component on its own. It's a complicated challenge globally. But the biggest challenge that we face is, as at today, despite all the advances in treatment and care that we see around the world, we are seeing an increasing number of cancer cases year after year, now at 20 million per year. As you just mentioned, January was 1.8 million. And we're seeing an increasing number of deaths each year, currently 10, and forecast to grow significantly in low middle income countries. And that's where our challenge is, because the increase in the population, the aging population, is occurring in low middle income countries, and that's where the health systems are simply not in place to cope with that increase over time. So we have to change our global priorities and national priorities to put in place the core infrastructure to educate people so they present early, and then to treat them well with good, solid medical equipment, and also generics and biosimilar medicines which work as of today. Not to say the new ones coming through, just the basic medicines which everyone needs to get through their breast cancer or whatever it may be. And I will say it's a delight sharing the stage with Runcie, and you undersold him, all right? Because he was a young leader and continues to be a young leader for UICC. And yes, he plays a key role in Nigeria, but he's a global player, and we consider him part of our family. So, you have an excellent global ambassador sitting beside you on this screen.
Thank you. See, And I just came and bumped into you at the MPP, which luckily for me, not luckily for me, but I just also became a board member, panelist, community panelist for the medical patent pools. And that has been an eye-opener, considering I've just come into the space within the last 3 months. So Ronsi, thank you. Thank you. And this is a question now. In what way is this year's World Cancer theme? Now, you see, I'm very glad because, as Carrie has just said, you are both sharing the space that you're very familiar with globally, theme. Closing this the healthcare gap, expected to narrow the gap in cancer care in low middle income countries. Focus, please, on Nigeria. Did you get the question?
Yes. Yeah. Thank you very much, Dennis. And also thank you so much to African Independent Television for really hosting us and have continued to really support cancer control. Yeah. You see, one major gap that I would really stress in cancer, especially in Nigeria and many low and medium income countries, are really two. One is financial toxicity, and secondly is really cancer research. And when Carrie was talking, Carrie mentioned something around global inequity. When we talk about global inequity, what that means is that cancer patients all over the world are the same. So a breast cancer patient in the UK, a breast cancer patient in Switzerland, in Nigeria, in Lagos, in any city is the same. What is different between this cancer patient is the kind of medication they have access to. And that is the greatest challenge, especially in Nigeria. I really have over 200 women who I work with every single month. The problem is that most of these women don't have access to the kind of medicine that will give them the chance to really survive cancer, like other patients in other parts of the world. And I think that is a major gap that we can close in this country. And I want to use this opportunity to really commend what UICC is doing, especially in mobilizing action, mobilizing resources, engaging with different countries, different governments to really make an impact in cancer control. Nigeria, for instance, have taken a very strong stride. Before, when I travel for conferences, people say that Nigeria, it's not really doing enough to really, curtail cancer. But we're seeing progress. The president, for instance, right now, signed the bill. Dennis, you remember we talked about this just a few weeks ago. The president signed the bill in 2017 to set up the National Institute for Cancer Research and Treatment, in 2017, and recently have just appointed a director general. That is a great step. It's a fantastic, phenomenal step in the right direction. What that means is that we now have someone we can hold responsible for incidence of cancer, for cancer death. If a radiotherapy is not working, you know who you can hold accountable to. And that is progress. We've seen what is happening in Kano. Kano just launched a center that has almost, 2 radiotherapy centers. We see what is happening in River State. So there are progress. We can no longer be a country where the global community will say we're not serious, that we don't have the facility, we don't have the infrastructure. We have the infrastructure. I think what is really needed now is that global investment in cancer need to begin to really come to Africa, to come to Nigeria, because clinical trial is really low. And that is really where the world is going. There's a need to really engage more Africans in medications development and also research in cancer.
Thank you. You see, you just answered like 3 different questions. Please do not miss out the cancer center that has just been opened was launched towards the end of last year in Borno. The question is, and it is a question for me, and I state it. You see, you guys are in a different place from me. Is it working? That is an issue for me. Are patients in there? That is an issue for me. And I'm very clear on it because I live with this disease, so I'm not going to be nice about it with all of the political, goodwill, if I do not see it translating to our lives, because living with it and having to battle this is all well and good to have things on paper. So let's continue. But I'm just bringing it to the forefront. I've also been told that there is a cancer center now being built in Tulare that should be opened anytime this year. So yeah, we're making progress, but it's okay to have the buildings. That's not good enough for me. It's when it is working and we start reducing the numbers and we start making sure that the patients have access. Because if you build a building and the patients can't get treatment because they can't afford it, that's the next challenge. So let's go on to the next one. And the next question I've got here is, there is obviously a global disparity in cancer control across the world, which we all agree. And as we know, in sub-Saharan Africa, there is a high cancer burden with very little facilities, which we've just mentioned, manpower for treatment and all that. So what structures do the UICC have in strengthening areas of capacity building and training, especially in Nigeria and the continent, the African continent, and low middle income countries? That is very important for me, low middle income countries. But I will use Nigeria as the base in this conversation. Carrie, please, can you help me with that?
I wish I could help you and sort it all out. I wish I could. The truth is, it's a massive challenge, and UICC's role is really in two parts. I mean, we have three parts maybe. The first one is that obviously we have some funding, not a lot of funding, but we can make funding available to organizations like Project Pink Blue. We can do training, we can do education, we do guidelines, we connect people, we try to support countries and also individual organizations to reach out to the community and not try and reinvent wheels, but really learn off each other. And we can do that through the World Cancer Congress or on a day-to-day basis. But that, to be honest, I mean, whilst we do have some funds, it's not anywhere near what's required. I mean, Runcie mentioned the financial toxicity. I mean, we need governments to put cancer as very much a health priority within their own agendas. And that work is where the second part of UIC's role is working with, for example, the World Health Organization or working with the UN to ensure that we get global resolutions of commitment from member states around the world to say, yes, we believe that not only cancer, but non-communicable diseases are the diseases of the future that we need to focus attention on. And they need to be included in our universal health coverage plans. Now, UHC, as you know, theoretically, would address the financial toxicity as well, because it would extend the degree to which individuals are covered by health insurance or their treatment is covered by government funds. So we work in that space. We're trying to make sure that all the global debates are very clearly understood. The challenge we face in cancer, the funding challenge, the treatment, access to treatment challenge, and the inequity challenges. We do that. But I think the other thing that we can do is we can kickstart projects and programs which can themselves become quite impactful. So, for example, in the recent years, we have launched the City Cancer Challenge Foundation, which is working with cities in low and middle income countries, bringing international experts into those cities to allow them to understand the challenge of cancer treatment and care they have, and to bringing the world's experts and resources and hopefully funding to support their plans to address that. And only last year, in the middle of our 3-year campaign, World Cancer Day campaign on inequities, we launched the Access to Oncology Medicines Coalition, the ATOM Coalition, which has now got 45 international partners and all of the pharma companies, nearly all of the pharma companies, trying to work out how we can get their medicines into low and lower middle income countries at a price point which is acceptable, reasonable, or extending donations, or, as you mentioned earlier, working with the medicines patent pool to see if we can secure a voluntary license so that others can produce those medicines sustainably and long term to deliver into those countries at a price point which is acceptable to those governments, and they can put it into their budget. So I think there's the 3 dimensions in which we can help. One is obviously connecting and making sure that we learn off each other and support each other, providing some seed funding to get projects and programs going at a national level. Secondly, global pressure to make sure that cancer is committed to by governments around the world. And we've got the UN high-level meeting on UHC coming up this year, where we again will be campaigning for cancer to be included in the outcomes document from that meeting. And the third thing is about kicking off specific targeted projects where we know a collaborative approach can make a big difference. Now, with regard to the clinical trials, and I was interested that Runcie mentioned that, this is not just an issue for Africa or Nigeria. The Middle East has also got issues and challenges around this. And I'm aware that some UIC members are coming together to work with one of the pharma companies to extend their trialing across the Middle East. Okay, so I know that that's an example where UIC members come together and bring the expertise required by that company to give them assurance that this is something that can be done in a particular region. So there's hope, I think, in the future to reach out to companies to extend clinical trials across other parts of the world. And, you know, I applaud the efforts of Runcie and others to make sure that stays top of the agenda.
Oh, thank you. Now, you know, you did me a big favor because you answered two questions with this, with one. That just helped me. And Ronsi did the same thing with another one, which has helped me to really manage my time, because my time is up now. But I'm going to ask you one last question, and this is to both parties, and it's just in one line. I just want you to say one thing. Can you give Nigeria today, or rather tomorrow, we will be celebrating World Cancer Day, and I want to know what message, goodwill message you have for us in Nigeria. Starting with you, Ronsi, can you give us quick one sentence, please? Go on then. Message to everybody in Nigeria. You go on.
Okay, I just wanted to say that Nigerian patients are dying in pain, and we can really reduce this burden of cancer if we are all able to really make more efforts in reducing the burden of cancer. Many Nigerians are surviving from communicable diseases like HIV, and they are now dying of cancer. Cancer is just a great example of global inequity, and we can do something to change it.
Thank you very much, Ramsey. And the same question goes to Kerry.
Well, World Cancer Day is about a celebration. And the reason it's a celebration is because we are making progress. There are massive gaps. There are massive problems. Runcie's right. People are dying unnecessarily. People are dying in pain unnecessarily. We could avoid all of that. But we need to bring the community spirit together. And if I know the people I know in Nigeria, like yourselves, Ifeoma, I know it's Omalola. I've got Zainab's on my board as well, from Kebbi State. You have got incredible people that can make change happen. And if the UIC community around the world can help you make change happen, then we can use that as a case study to inspire other countries.
We will be working very hard to make sure we achieve this. And Ronsi, have you heard the challenge now? 2023, we all have to move forward. I want to thank you, Evan. Thank you very much, Kerry, for joining.
I just wanted to quickly say that we have the World Cancer Day walk happening tomorrow at Transcorp Hilton at 7 a.m. and AIT is one of the sponsors of this event. So I want to urge all Nigerians who live in Abuja to please come and join us, and let's celebrate cancer survivors and continue to ask the government at all levels to really make impact in cancer control.
Fantastic. That's a very good way. I was just about to say that, but you said it for me. So you just saved me having to say that. So I want to thank you all viewers for watching us this morning. Thank you, Kerry, for being with us. Thank you for making a difference, because I know I just caught you unexpectedly on Monday and you agreed to do this. We really appreciate it. And to everybody in Nigeria, I want to thank you all as cancer survivors and cancer patients. We really ask that you engage with us, believe and trust that we will all be able to get through this together.